Oh,
Whatever you say.
Bam. We in there.
Like swimwear.
hello, greetings. Hello, everyone. Welcome to the Cape MD. Again, we have an exciting and informative and comical show for you today. You know how we do. We combine medicine with personality and transparency, and most importantly, authenticity. So we're going to wait about a couple of minutes, and I'm so excited to introduce our guest today. She is amazing, and as you can see, she's Black Girl Magic too. So we'll wait a minute or two, and then we'll introduce her, and then we'll get started with today's episode of the Cape and D Lupus. Everything about it, everything you should know, everything you need to know. All right, what, 50?
More quiet we never been.
Another minute? I know. I have a booger. I want to get it out, but I won't.
Girl, you
No,
these
no,
on the live.
You know, what you see is what you get. I'm the most transparent doc probably out there. Maybe a little bit too much, but what else? And these days, hell, that is warranted.
I'm trying to share to my page, but I'm having difficulties.
Technical difficulties.
Yeah.
Can anybody see how many viewers we have?
I see 4 at the moment.
Okay. Hi, 4 viewers. Thank you for your promptness. We appreciate you. Bear with us as we wait for at least 6 more. Can we get 6 more for a total of 10 to get started promptly?
Let's start, girly. Let's start.
Okay, Dr. Tamika's cracking the whip. All right, y'all. Today is Thursday, November 5th, and we will take your mind off of the pending election results temporarily for another episode of the Cape MD. This is Lupus, everything you should know, want to know, and need to know. Again, this is Dr. Tamika on my right, Dr. Kristen on my left, and Dr. Amber below me. And again, I'm Dr. Lakeisha, and I am so excited to introduce to you all another one of our Black Girl Magic colleagues and friends. This is Dr. Ashira Blazer. Boop, boop, boop. She hails from NYU, where she is currently faculty, y'all. She is like a zebra. I mean, a needle in a haystack. She is a Black female rheumatologist. Now, for all those who don't know, rheumatologist is a very specialized field, but she is also, y'all, a lupus expert. And I'm not just saying that lightly. She is a national leader and expert for the Lupus Foundation of America. She sits on their advisory board. She's on their research board. She went to the University of Vanderbilt for residency. She went to Baylor for medical school. I mean, Miss Sang is all on fire. And look at that hair. Isn't it beautiful? So without further ado, I want to introduce our lupus expert, Dr. Ashira Blazer. Thank you, sister, for joining us.
Thank you. I'm going to come on here more often.
So y'all, we're just gonna jump right in. Y'all know how we do it. We have our wine, we have our expert, we have our questions, and you all pop in with questions and comments as we move along. So I'm gonna let Dr. Tamika take it away with our first question for Dr. Blazer.
So, hello, my dear. So I think one of the biggest things that people always ask me is, well, what is lupus? How do I get it? Like, what exactly is it? And how did I get this disease?
Yeah. So, I mean, I think whenever I say lupus is an immune condition, people are like, oh, like HIV. And I'm like, no. It's not infectious at all. It's actually, so everybody has an immune system, and our immune systems are supposed to protect us from viruses, from bacteria. However, in lupus, the immune system starts to become active against your own healthy tissues. So, it's not something that you can catch. It's not communicable at all. But for some reason, the immune system starts to recognize your own body as something that's foreign, and then it starts trying to carry out a response against it, causing injury.
So I think the other issue is like, well, how do I know if I have it? Like, where it's coming from? How I have joint pain, or I have this, and someone told me I could have lupus. So how would I even know?
Yeah, so I think that's a huge question. And I think that is, especially for women of color, lupus can take a while to diagnose. We have issues with access to care. Some of our symptoms are different than the classic lupus symptoms because the classic lupus symptoms were found in people who were not of color, right? So, I think it's one of those things, and we call it the great mimicker because, you know, the immune system is carried in the blood by white blood cells, right? So that means anywhere the blood can go, lupus can go. So some people have joint pain. Some people have, fatigue or hair loss or rashes. Some people have kidney issues. There's so many different symptoms that can go along with lupus. And the only way to really know is to put all those symptoms together and, go to a doctor who can say, this constellation of symptoms sounds like lupus. We're going to do some supportive blood tests to make the diagnosis. And just to add to that, a lot of our lupus patients will have symptoms sporadically and then they will go away and they'll have other symptoms. So I would say to anyone who feels badly and they're not sure what it is, keep a little diary, keep a diary and say, today I had joint pain. This lasted for a couple weeks. Okay, well, then the next week I had a rash, right? And so now when it comes time for you to go see your physician, you can say, this is actually the history of everything that's happened, and it makes it easier to sort of put it all together.
Dr. Ashira, what's the typical age range in which people are usually diagnosed? And is lupus more prevalent in certain populations? Like, for example, is it more prevalent in women than it is in men?
Absolutely. Yeah. So lupus is much, much, much more common in women. For every 9 women who has lupus, there's 1 man with lupus, right? So it is by far and away female predominance. It's also more common in people of color. So it's most common in people of African ancestry. And I actually specialize in lupus in people of African ancestry. So for every 1 person of European ancestry who has lupus, there are 4 African American women who have lupus, right? The highest incidence is actually in Afro-Caribbean women, where 1 in 250 Afro-Caribbean women has lupus. So, I think that this is one of those things where, like, all of us kind of know someone who has it, right? Like, I'm sure if you thought back, you could think, oh, well, this person has lupus, that cousin has lupus, that, it's one of those things that sort of touches all of our lives because it is so common in our communities.
So you've mentioned a couple of the other signs or symptoms that someone with lupus may have, like you mentioned, how it may affect joints, how it may affect kidneys. So those are some things that people may not necessarily see. But can you tell us how it affects like the skin and the hair and maybe what things people should look out for?
Absolutely. Absolutely. Yeah. So, just to sort of give a full picture of lupus, when we're diagnosing lupus, there are 11 different classification criteria, meaning 11 different body systems that can be affected by lupus. One of my patients actually called it lupus on the inside versus lupus on the outside, right? So she came in and she had a horrible rash and I was like, oh, I'm so sorry, we have to treat this. And she's like, this is just lupus on the outside. You should have seen me when I had lupus on the inside, right? Like, because she ended up having some pretty severe disease. But I will say that when I tell people about their lupus symptoms, there's symptoms based on inflammation in certain areas, and then there are symptoms based on just immune activation, right? So what I mean by that is, like, if anyone's had a bad flu, right, or a bad cold, that you feel tired, you feel run down, you might have a little fever, right? Like you can't get around very well. All of that those are symptoms of immune activation. So a lot of our patients will have those symptoms, and they're not specific to lupus. They can be, if the immune system is active for any reason, you might feel that way. So I think one of the reasons why people get misdiagnosed a lot is because what they're complaining of is, I'm too tired to go to work, right? I feel so run down. And they go to their doctor and they say that, and doctors say that could be anything, right? Now, the symptoms of inflammation in body systems are the ones that are a little bit easier to pick up on. So this is why I encourage patients to take a look and see if they're having those. So those are, arthritis is one of the most common symptoms of lupus. And when I say arthritis, I mean usually pain and swelling, especially in the small joints like the hands, elbows, shoulders, right? Usually worse in the morning. Usually you wake up and you're stiff, like it's hard for you to make a good grip on things because your hands are too stiff to move very well, right? That kind of stuff suggests inflammatory arthritis, meaning the immune system is active in the joints. There are classic rashes of lupus. And, for European American women and people with fairer skin, the classic rash is this butterfly rash. I think a lot of people have heard of that. It's like the rash just on the cheek area. It's not over the lip, just on the cheek. So it turns out that when we think of that as like the lupus rash, that is the lupus rash for people with fair skin. Women with darker pigmented skin tend not to have that as commonly. But what we do have is something called discoid rash. So discoid rash is, and this rash is, when it's bad, my heart just goes out to my patients, because it's a roundish rash. It's a little bit lacy on the outside. It's a little bit either reddish or purplish in color on the outside. On the inside, the skin is sort of like thinner and scarred. So one of the common places for this is actually in the scalp. And so when patients get that, they'll lose hair where the rash is. And unfortunately, because it's scarred, the hair won't grow back in that area, right? You can get it on the ears, upper chest, the upper arms. That's a classic rash for lupus. As well, hair loss unrelated to discoid rash. So lupus patients will lose hair very often. That can be a sign of lupus. So those are the ones, easy bruising, things like that. Those are the ones that are sort of on the commoner side that might suggest lupus.
So speaking of kind of that discoid rash on the scalp, I get a lot of patients who come in and say, they'll have their wigs on and they're like, oh, I was told I have alopecia. Like, oh, let's take off your wig. And there's been a couple of times and I'm like, this isn't alopecia. And so my biggest thing to patients is if, we tend to get diagnosed from our friends and family, making sure if you're worried about something, bringing it to your physician's attention, because what other people may say, oh, girl, that's just alopecia, girl, wear your wigs, you're fine, may be an underlying condition that you didn't know you had.
Yeah, for sure. And I think the caveat here is that every woman thinks she's losing her hair. Right? We don't think we should lose a strand. Okay. Like if anything falls out and you in the shower and you brush your hair, that's alopecia. Like that's not what we're talking about. Right? Like if you brush your hair and some hair comes out, that is normal. If you shower, some hair comes out, that's normal. And in fact, all of us go through phases. There are phases where our hair is growing and there are phases where hair is not growing as much and it may thin a little bit. That's normal. But I say to my patients, if you notice like patches, if you notice that you're waking up in the morning and there's hair on your pillow, that is a sign that this might actually be alopecia and might be a problem.
Dr. Asher, what are some of the most common presenting symptoms in women of color?
Yeah, so women of color tend to have lupus more often and tend to have more serious lupus, more severe lupus. Okay. So unfortunately, lupus is the kind of thing where if you ever cut yourself and it heals with a scar, that whenever there's an inflammatory reaction, the resolution of that is often scarring. Okay. So, when you have lupus and you have inflammation in certain parts of your body, a lot of times the healing process leaves a scar. Now, if you have lupus and it causes just like joint pain or a little rash, likely you don't have that problem. But when you have lupus on the inside, for example, kidney disease, and you have inflammation in your kidneys and that heals with a scar, now you start to accrue damage in your organs, which means those organs don't work as well as they did before you had that episode. All right. I say that to say that women of color with lupus are more likely to present with internal organ manifestations, and in fact, kidney disease. So, up to half of Black women with lupus, their first presentation of lupus is kidney disease. So this is why it's so important for people to recognize that there's something going on, and also for doctors to educate themselves on the symptoms of lupus, because, missing a diagnosis of lupus within the first year when someone has joint pain or rash is one thing, but missing it when their first symptom is kidney injury may actually shorten that person's life. So early diagnosis is so important. Early diagnosis in women in color is a life or death scenario.
Wow. What does that kidney disease look like in terms of symptoms for our viewers?
Yeah. So, usually the first thing that happens, so your kidneys are responsible for filtering your blood completely, right? So the toxins in your blood are filtered by your kidneys. Also, the liver takes care of the toxins in the blood. So kidneys are going to filter the toxins, and they're also going to deal with your water balance, right? So that means that the kidneys are going to make sure that you don't become dehydrated and you don't become overhydrated, right? So one of the things that happens when you have lupus kidney disease is that proteins in your blood that should stay in the blood and not filter into the urine start to filter into the urine. And that means that I sort of explain this as like certain solutes will pull water into the bloodstream, right? So if you don't have enough of those solutes, then the fluid in the bloodstream just sort of settles out into your tissues. So we see that as edema. So we see, like, first thing that'll happen is patients say, I wake up in the morning and it's puffy around my eyes. Like my eyes are just puffy, right? And that's because when you're laying down, your head is like, gravity's pulling fluid towards your face. And then you wake up in the morning, you have puffiness. The next thing that happens is they say, oh, I have puffiness on my legs. Like whenever I put my socks on, there's an indentation, right, on my legs. Or I can't fit my feet in my shoes as well, right? Everything looks a little bit tight. That's edema in the legs. Those are some of the first signs. The other thing that happens is people who, and this is subtle. So I usually tell this to people who already know that they have lupus, because there are lots of reasons for this. So I don't want to freak anyone out, right? But like, say, you have lupus and usually you're able to sleep through the night, but you find yourself getting up 2-3 times a night to go and pee, right? Your kidneys are responsible for, like making sure that you don't filter so much into your bladder at night that you have to pee all the time. They concentrate your urine so that you don't have to, you can sleep through the night, right? But when your kidneys start to become damaged, that's one of the first things to go. So all of a sudden you have to get up and pee at nighttime, right? Those can be signs that the kidneys are involved.
That was good. Thanks. What are some common, I guess, like myths versus facts? We've done a lot of facts here.
Yeah.
What are some common myths that you often find communities of color thinking, or misperceptions about lupus that you have to correct?
Yeah. And here I want to say that communities of color are not monolithic, right? All people in diaspora are more likely to get lupus. I think the one most common thing that I hear is that, that there's like some natural remedy that's going to make it go away, or, like, I think that we love some natural remedies, right? We are not trying to take medicine, and that has roots in history and a lot of mistreatment in the medical field. So I get it. But the thing about lupus is that it's not the kind of problem where you're the same amount of sick all the time, right? It's the kind of thing where you have flare-ups and then they resolve, and then you have flare-ups and they resolve. And like the average lupus patient who's not well controlled may have 2 or 3 flare-ups a year. So say somebody has a bad flare-up, they get better. the first thing they want to do is come off the medicine because they're like, oh, see, I did, Dr. Sebi said, they're like, I took this alkaline water and I'm good. Right. And I think that is so dangerous because like I said, whenever you have a flare of lupus, you have inflammation in whatever organ the inflammation happens, and then it's going to heal the scar. And now you have damage. And the next time you have flare, you have an inflammation, and then you have scarring and damage and inflammation. So the fewer flares we have, the less likely we are to end up with permanent damage from our lupus. Now, the medicines that we give for lupus, we give all of the time because we know that if you stay on those medicines, you're less likely to have a flare. You're less likely to have that next flare. So whenever people say, I'm taking these juices and berries and like now my lupus is cured, basically they're in between flares, but we know that that person is going to be more likely to get another flare and then more likely to deteriorate in their health over time. The other thing I hear, especially from communities like West African communities, sometimes communities from the West Indies, is that lupus is a spiritual attack. Like somebody has like cursed you, or you have some sort of spiritual something, somebody put something on you, and that's why you have these symptoms. And, it's something that happens to young women, right? It usually happens to women of childbearing age. So I think that's a time in your life where people don't expect you to be sick. So all of a sudden this young woman comes up and she's lost a bunch of weight. She has hair loss. She has a disfiguring rash. And people say, oh, you've been cursed. You need, So I think that is something. And, in that scenario, people often turn to spiritual practices in order to feel that they're remedied from the disease, right? So I always say, spiritual practices are really important. Supporting yourself, your health, which means your spiritual health too, really important. But that does not take the place of, the medications and the healthcare that you can get. And also, God was on your side when they gave you this diagnosis, and that doctor who cares to give you these medicines. So, faith without works, right? Like
that is true.
You need to make sure you're taking care of yourself.
Say that for the people in the back.
Right? Yeah, like you have to make sure you're taking care of yourself on all levels,
I think what's interesting, one of the things that you have talked about today was just kind of how it affects different people differently. Looking at the story of Toni Braxton, we all know who Toni Braxton is. She's had lupus since I think 2008, and she's dealt with this to the point where her doctors at one point told her she may need a heart transplant and may never ever be able to perform again. And so I think one of the things that is really important to reiterate is, I get a lot of patients who say, well, I want to come off my medicine. And my advice to them when they tell me that as a primary care doctor is, one, what your rheumatologist say, but two, this is a lifelong disease that we want to prevent you from having lifelong complications that would potentially cause you to end your life, for your life to end. I don't want you to have end-stage renal disease. I don't want you to need a heart transplant. And I think her case is one of those severe cases where Toni Braxton is gorgeous. She sings, she's super talented. She has all these things going for her, but yet and still she has this chronic disease that she has to take medicine for every day.
Right.
And so we need to remember, this is what's saving you. This is what's keeping you healthy. And health, we talk about this all the time, health is wealth. And so it's really important that we continue to try to teach each other and help each other get through it as well.
Sure. Yeah, no, I totally agree with that. And I also think that, there are certain medicines that I feel like all lupus patients should be on, but those are pretty minimal medicines. And so a lot of my patients who are into holistic care, I say, let's work together on this. Like if you're coming in and you have like a big kidney flare, then obviously you're going to need heavier medication. But if you're more stable and you want to incorporate holistic practices to try and keep your lupus under control, and you're on like baseline, like so hydroxychloroquine is a medicine that I want all of my unless there's some reason you can't take it. I feel like all patients need to be on hydroxychloroquine. One, because you avoid steroids. I think I was shocked. There was actually a study that came out looking at prescribing practices for lupus patients, and it showed that nationwide, only 40% of lupus patients were on hydroxychloroquine, and 75% of them were on some dose of prednisone or glucocorticoid. And I was shocked. First of all, hydroxychloroquine keeps you off the glucocorticoids, keeps you from having a flare. We know it keeps you from getting diabetes, especially secondary to prednisone. We know you don't have as much heart disease if you're on hydroxychloroquine. You live longer, you have less damage. So that is a drug that we know does a lupus body good, right? Prednisone, on the other hand, has a lot of it's one of those things that knocks down the inflammation quickly. It's one of those things when you're sick, it makes you feel better quickly. But if you take too much too long, it's going to have a lot of side effects. And in fact, over time, it's going to cause a lot of these things that actually shorten the lives of lupus patients. So, when my patients are like, I don't want to take hydroxychloroquine, I don't want to take anything, I'm like, taking this hydroxychloroquine is going to spare you that prednisone that's going to cause you more problems in the future, right? Like, by taking the minimal drugs, you keep yourself off heavy steroids, you keep yourself off chemotherapy, you keep yourself off all of these things that are going to be a little bit harsher, like much harsher on your body, right? So, baseline, I like my patients to be on hydroxychloroquine. I also am a big fan of vitamin D. The best evidence for vitamin D is in people who are vitamin D deficient, but it's one of those vitamins that helps regulate the immune system. So it's one of these things that is not immune suppressing, it's immunomodulatory, meaning that vitamin D and also hydroxychloroquine help the immune system behave in a more normal way rather than decreasing the function of the immune system. So, I'll say to my patients, if you want to do vegan diet, you want to make sure you're getting enough sleep, you want to do your alkaline water and hydrate or whatever you want to do, fine. We'll work together and I'm going to monitor you closely. But I want you to be on these minimal background medicines that don't have a lot of side effects and I know are going to help you live longer, So it's not like the treatment plans are not one size fit all. And I think that it's a communication with your physician, but you're right in that it is something that you need to keep tabs on and likely that you're going to need to take medication for the rest of your life.
So thank you, Dr. Scher, for that information. And as a chronic pain physician, I'm oftentimes seeing patients who are presenting with me who have lupus, who have joint pain. And I am very surprised to see how many of them are being treated with prednisone and very few that are being treated with hydroxychloroquine because for whatever the reasons are. And I would oftentimes ask them, have you talked to your rheumatologist about being on an immunomodulator? And many times I think there's some misinformation about immunomodulators that are used to treat lupus. Yeah. So, with regards to pain, how best to treat patients who have chronic pain symptoms, and is there any evidence to suggest that the immunomodulators help with some of the pain symptoms as well?
Yeah, so that's huge. That's huge for lupus, and I think that's one of the areas where we don't have the best answers, because there are a lot of reasons to hurt with lupus, right? Sometimes you have a lupus flare and it's causing arthritis, and the arthritis is what hurts, and you give an immunomodulatory medication, and you can get rid of the inflammation in the joints, and now you feel better. But as you know, a lot of patients who have arthritis and chronic autoimmune diseases can have overlapping fibromyalgia. Mm-hmm. So, fibromyalgia is one of those things. So essentially, I was like, have you ever cut yourself and you didn't notice it and it doesn't hurt, but then when you see the blood, all of a sudden it hurts like crazy, right? Like that happens because the sensation of pain is a two-way street. It's not just whatever happened in the periphery, it's that injury. And then those signals go up to your brain, and your brain says, how dangerous is this? How much does this hurt? How anxious am I? And it puts together chemical signals that go back to the site and cause you to hurt more or less, depending on how that negotiation went, right? So with fibromyalgia, the brain says, this hurts a lot. It hurts a lot. It hurts a lot. It hurts a lot, right? And part of the reason for that is when you have chronic pain, we evolved to have like acute pain, right? We like cut ourselves, or there was like a bear chasing us or whatever, and we got away from it and we're fine, right? But when things hurt chronically, your brain is like, why are you not getting away from this stress? Hey, listen, honey, this hurts a lot, right? So like those pain pathways can get ramped up and ramped up and ramped up. And so we see in people who have like things like chronic arthritis, arthritis related to lupus, or pain related to lupus, that secondarily they can end up with fibromyalgia. The other thing that happens is whenever we don't get enough sleep, we are likely to have secondary fibromyalgia, right? Sleep is very important for regulating our pain pathways.
Yes.
So a lot of my patients either, they don't sleep because they're like shift working, or they don't sleep because they just not trying to go to bed at night, or they have chronic anxiety. They have pain, and the pain keeps them from sleeping, right? Some of them will gain weight because they took too much steroids and now they have sleep apnea, right? Sleep disorders can greatly contribute to chronic pain. So, whenever somebody comes in and they have chronic pain related to lupus, I try to just get like a whole inventory of their lives. Are they exercising? Are they sleeping? What's their self-care regimen like? Like, how are they eating at home? What's their stress level? Do they have anxiety? Do they have depression? And I try to let them know that chronic pain is not something that's going to be cured with a pill. Like, there's no medicine I can give you that's going to make this better. It's a lifestyle change. And then I try to bring in interdisciplinary. So my pain management docs, right? Like, I bring in like interdisciplinary teams to try and help mitigate this pain syndrome. Because in a lot of those cases, just taking an immunomodulatory medicine is not going to help, unfortunately.
Thank you.
Okay, Cher, this has been so informative, even for me as a physician. I was hoping that you can educate me on how to decipher between the initial pain stages of lupus versus fibromyalgia versus rheumatoid arthritis.
Yes. Again, so lupus is a great mimicker. So a lot of these things are going to overlap. So whenever I think about the arthritis of lupus, looks very similar to the arthritis of rheumatoid, right? In that they are both inflammatory arthritis. So whenever I'm trying to distinguish the two, symptomatic, I go by symptoms first, right? So are you having the stiffness in your joints? Are the key joints? So it's usually these knuckles, those knuckles, right? Are those key joints affected? Is there ever swelling, right? I do an exam. Do I feel the bogginess? Do I feel the synovitis in the hands, right? And what time of day is it bothering me the most? Usually somebody who has an inflammatory arthritis, like I said, will have worse symptoms in the morning, and the stiffness and pain will be the worst for maybe an hour, 2 hours in the morning, right? Longer than 30 minutes, less than, like 4 hours or so for the most part. And then they'll say things like moving it makes it better. Sitting too long makes it worse. I have to run my hands under hot water. That makes it a little bit better. Or they'll take things like NSAIDs, like ibuprofen, things like that, and that makes it a little bit better, right? So those things suggest that they have an inflammatory arthritis, and I'm in the lupus versus rheumatoid category. The next thing I say, is this arthritis or is this arthritis plus, right? So now I'm hunting for other symptoms that might go along with lupus. Is it arthritis and also a rash? Arthritis and also some hair loss? Are your legs puffy? Are your eyes boggy in the morning? Are you having chest pain when you take a deep breath in and out? Do you have sharp chest pain? That could be pleurisy, right? So I'm looking for all of those other symptoms that might go along with lupus, and rule out just plain old inflammatory arthritis, right? And then the last thing, and I say this on purpose, the last thing is the blood tests. A lot of people have gotten an ANA and they think they have lupus, right? People think that an ANA is a lupus test. An ANA, just for people who haven't heard of it, is an anti-nuclear antibody. So what do I mean by that? So I said that lupus is a problem where the immune system starts to become active against your own healthy tissues, right? So the building block of your tissues are your cells. Every cell has a middle part called a nucleus, right? An antibody is a protein that the immune system makes that can be targeted against a certain thing. So when I say an anti-nuclear antibody, I mean an antibody, the immune system protein, has been targeted against the nucleus, meaning the inner portion of your own healthy cells. Okay. So that test, 95% of people who have a positive test have no disease at all. All right. Most ANAs are false positives for lupus, meaning most people who have them, they don't have it or they have some other problem, but it's not lupus. All right. It's only a supportive test in the context of the right symptoms. Okay. So that was sort of a tangent. But this is sort of how we get to lupus versus rheumatoid arthritis. And then the last thing with fibromyalgia. So there are certain characteristics of fibromyalgia. One is that fibromyalgia is not just concentrated on the joints. So where somebody who has lupus or rheumatoid will say it hurts and it hurts in these joints, somebody with fibro will say it hurts all over, right? So it's the joints, it's the muscles between the joints, a lot of different places will be painful. Usually people will have chronic fatigue, and usually people will also have mood symptoms along with the chronic pain. And then there's not the same pattern. Like somebody with fibromyalgia will say, I hurt all day long. Whereas somebody who has inflammatory arthritis is like, it gets a little bit better after I get moving in the morning. So I think cues like that suggest fibro versus lupus. And again, it can get confusing because both rheumatoid arthritis and lupus can have secondary fibromyalgia. So you may end up having both. Dr. Amber, what are your thoughts on the chronic pain part of it? Oh, you're muted.
You're muted. Don't you hate that when people take 5 minutes?
The most common phrase since March of 2020, you're muted. So, no, I would agree that fibromyalgia, I would agree with everything that you just said. And, the fibromyalgia patients will complain of pain all over, muscle pain, joint pain, interference with sleep. Obstructive sleep apnea is a common coexisting diagnosis. And we've come a long way with destigmatizing fibromyalgia because we are gaining evidence-based information about the underlying mechanisms. And we know that for fibromyalgia, that there's an underlying inflammatory component. We know that nerves are being disrupted. And so, I think we are moving, especially in the medical community, to really embrace this as a real diagnosis. Whereas, when I was training in medical school, I think there was still a lot of doubts, even in the medical community, about what exactly fibromyalgia was. And honestly, a lot of stigma around it, especially for women who were presenting with these sometimes vague symptoms that don't fit nicely into any one category.
Right. Yeah. Yeah. And I think that's a huge, and I still think that that's a problem where, docs are thinking fibromyalgia, and I also think that there's not because it doesn't fit into a box, there's not an easy answer. And so patients get frustrated, doctors get frustrated, and then that fuels the stigma. But I think the more we learn about fibro and real solutions for it, the less that stigma persists.
Yeah. I think the hardest part of
I
fibro, though, is
know.
no one wants to be diagnosed with fibromyalgia because of the stigma that
Right.
comes with it. And it's so hard
Right.
when that's what you're left with. And they're like,
Yeah.
I reject that because you're not telling me the whole story. And I'm like, well, all your labs are normal and these are the symptoms you have. And there's nothing wrong with
Right.
this diagnosis. It's a really hard one in today's society
Yeah.
to diagnose someone
Yeah, it's a
with.
hard one because of the stigma. It's a hard one because it's like, what do you do? Like I think fibromyalgia it's one of those things where there are so many factors that contribute, and taking care of just one of them won't fix the problem. And you're on a journey. Like, this is not let's do a little physical therapy and it's over. You are on a journey with this, and it's not a one size fit all solution. And I think, it's frustrating. People are miserable and nobody has the answers. And it's just, it can be really problematic.
Right. So speaking from a standpoint of where we are now, COVID is going up.
Mm-hmm.
Life is really hard. We have people who want to give away our hydroxychloroquine for COVID, which is not the use of that drug. But the question of the day is, are you seeing less patients and are less people being diagnosed in this COVID culture that we have because of what's going on? Are people not seeking help that they need?
So probably the answer to that question is yes. And that people, for all kinds of reasons, are not seeking the help they need. I will say that a lot of I've seen patients. So we were doing televisits for a while, and like when the cases in New York City were terrible, people didn't want to go see a doctor. And I've seen a number of patients who came in and they're saying, oh, I was home and I had this chest pain and I didn't go to a doctor about it. And now, by the way, I feel short of breath when I walk. I can't lay down flat. I feel short of breath. And, and they have like heart failure symptoms. And I think one of the terrible things about COVID is that people get sick for all kinds of reasons, not just COVID. But I think that people who are not getting COVID were not trying to go into the hospital or not trying to talk to their doctors, all those things. So I feel like people neglected their health quite a bit. And autoimmune patients, one of the largest causes of mortality in our patients is heart disease, cardiovascular disease, accelerated cardiovascular disease. So, women get it younger when they have autoimmune disease than other women. And they may have more subtle symptoms. So I think the most unfortunate thing I've seen in my patients is people who did have that cardiovascular event, stayed home, and now they have, a chronic heart problem from it. I would not be surprised if some people with symptoms of lupus ended up not coming in because of it. So.
Dr. Shearer, can you speak towards different treatment options with respect to the pain portion of lupus? I know a lot of people in our community now are really big on CBD, are really big on some, cannabis in legalized states, we'll say that, medicinal cannabis.
Yeah.
And then, of course, there's opioids. Can you just speak towards how you deal with that?
Yeah, sorry. Okay. I was just muting. I don't know if you guys heard, because I live in Harlem, there's a guy who every night has drives over in a truck and is just playing loud, West Indian music.
We did not hear
it. Good. I'm like, really now?
I'm trying to live it in New York. You never know what you're going to get.
I know. Anyway, yeah. Okay. So for the pain. So again, multifactorial. Certainly treat the lupus. If there's inflammation that's causing the pain, the anti-inflammatories are the answer. I am not a proponent of opioids in lupus at all, for a number of reasons. Because, I know that if you're having pain in lupus, it's probably either from the lupus or it's from the secondary fibromyalgia, which also is not well treated by opiates. The only time I try to use opiates is if there's an acute cause of pain that will be getting better. Chronic opiates are never a good idea. And in fact, you just build tolerance and you end up with addictions. And so it just gets people into more trouble than they're worth. So, opiates are like I broke my leg today, or I got my wisdom teeth out, and like I'm gonna be off this in a week, right? So opiates are not the answer. The other thing that I say for pain for lupus is that, especially in secondary fibromyalgia, there are a lot of medications that we would use usually for either anxiety or depression that also have secondary effects on the pain system. So we talked about, like Dr. Amber was talking about, there's a lot of dysregulation in nerve conduction. So a lot of those medications work on the chemicals that the brain and nervous system uses to conduct those signals. So, sometimes I'll put my patient on those medicines and they're like, I'm not depressed, I don't have anxiety. And I'm like, yeah, but it's for your pain, right? So that's another thing. And the other thing is there are a lot of holistic ways to take care of your pain with lupus or secondary fibromyalgia. Certainly getting more sleep if you're not getting enough sleep. I always get somebody a sleep apnea test, because if there's apnea, we're going to be chasing our tails trying to get this pain under control. But the other thing I say is like things like Epsom salt baths. And I sound like an old lady saying that, but Epsom salt has some magnesium in it, right? And magnesium is one of the cues for your muscles to relax. And sometimes people who have fibro, some of the pain in their muscles is that they're like tensing all the time. Like they don't even realize that they have like a little tension all the time. So things like warm baths with some Epsom salt, even taking oral magnesium sometimes can be helpful, especially in people who are deficient. So I go for a lot of like supplements and holistic approaches, especially for people who have more chronic pain.
Thank you. That was really good. That answers my question. To the oral supplementation people and intravenous supplementation.
There we go. There we go. I mean, there's actually a database called Natural Standard. I think it's called Natural Medicines now, but it used to be called Natural Standard. But it's a compilation of all of the evidence-based holistic medications. So like you can go in there and look up, you can put like garlic in there and it'll give you all the papers on garlic. You can put turmeric in there, it'll give you all the papers on turmeric, right? So then you can see actually the strength of evidence behind a lot of these things.
Well, this was so much fun, man. Time flies when you're having fun.
Yeah.
I just want to thank you so tremendously for the wealth of information that you brought to us and for this Black Magic beauty that you brought to us too. And we are planning to circulate this so that more people can see it, and we may get some questions that we might field to you because we may not be able to answer them very well. So if anybody has any last minute things, please blurt them out now.
Thank you. This was really informative. I learned a lot. So thank you for your time, and we really appreciate you. And just keep up the great work, and thank you for your service.
Absolutely. Thank you. Thanks for having me.
Absolutely. So guys, this is Dr. Ashira Blazer, lupus expert, faculty member at NYU. If you know anybody in the area who is suffering or they think they might be suffering from any rheumatologic disorders, please go check her out. And if you or you know someone who is an expert in any type of field, we'd like to be highlighted on our show, The Cape MD, please reach out to us at www.thecapec4PEMD.com. That's all we got for tonight, you guys. Thanks for joining us.
Thank you.
Bye.
Good night. Bye, Dr. Shara. Thank you.
Thanks so much.
Good night.
All right.